Legacy IAS Academy. In today's video, we are going to discuss about tobacco epidemic which is ongoing in India. So, why are we discussing about it is because recently we have crossed through World Anti-Tobacco Day. Okay? Talking about the statistics, India is the second highest consumer of tobacco in the world. Highest position is taken up by China. Okay? So, we are one of the largest consumers of tobacco, so it is a major cause of concern for us. Globally, if we talk about cancer related death burden, okay, cancer related death, का 23% share is lying in India. Okay? India में the largest producer of tobacco is Gujarat. Largest producer of tobacco. And 66% of the world's smokeless tobacco users. What is a smokeless tobacco? Smokeless tobacco matlab this will not be burnt. Okay, this is consumed unburnt. It can be form of leaves also, dried leaves also. Okay? So 66% of the world's smokeless tobacco users are present in India, and total number of tobacco consumers in India are increasing as per various surveys. Okay? So because of all of this, tobacco is a major concern in India. Okay? Now talking about the epidemic, what is the negative impact? What is the problem if we have so much amount of increasing tobacco users, because we know that tobacco brings huge amount of revenue. Okay? Then why are we discussing about economic loss? But all in all, we know that tobacco brings in huge revenue to the country. So what are the negative impacts? First major negative impact is health, of course. I told you that 23% of the global cancer related death burden lies in India. Okay? So there is definite impact on the one person who is consuming tobacco. It is highly carcinogenic in nature and can cause cancer. But those who are working in the sector of production of cigarettes or smokeless tobacco, they are also consumers, indirect consumers of tobacco. Okay? And on them also we will be witnessing health related impacts. Because of these health impacts, there are certain economic losses. What is the extent of loss? Is it more, if we are talking about economic loss, is it this loss more than the revenue that we are able to generate out of tobacco? If we talk about 2017-18 specifically, 2017-18 में, that year's health budget का 3 times was the economic loss that we have experienced because of the tobacco consumption. ठीक है? It was 3 times that of the health budget. 3 times of the health budget which was allocated for the same year. That is the extent of economic loss for consumption after consumption of tobacco. Okay? Plus soil quality also gets severely degraded because it is a highly erosive crop. Tobacco is highly erosive crop. Erosive in the sense it will take up too much amount of nutrients from the soil. Okay? So the soil quality, once the cropping cycle gets over, this is severely low. Okay? That is the third problem. And fourth problem is the social impact. So social impact, the children can get addicted, youth can get addicted, or the social impact borne by non-smokers such as children. Non-smokers who face the second degree or indirect smoke. Okay? For them also there will be some major amount of social impact, that is health related impact. Okay? So what has government done? Okay? Government has taken various measures. First was the cigarettes. The cigarettes and other tobacco products, prohibition of advertisement, regulation of trade and commerce, production, supply, distribution act. So under this, production, advertisement, distribution, consumption, all of which has to be regulated. We call this as the Kottapalya. Okay? So all of this is regulated. Okay? Cigarettes Act of 1975 mandates smoking is injurious to health. Smoking is injurious to health. This must be mentioned on the cigarette packet. This should also be mentioned on the OTT platforms or any other videos that are shown by broadcast media. Okay? WHO's Framework Convention on Tobacco Control, to which India is also a signatory. India is a signatory that we are trying to reduce tobacco consumption overall, which is the WHO's Framework Convention on Tobacco Control. Then we have Food Safety and Standards Act, which says nicotine or tobacco cannot be used in any of the food products. ठीक है. Then we have Motor Vehicles Act, wherein publicly smoking in public transports is prohibited. ठीक है. And then we have Cable TV Amendment Act, again smoking is injurious to health must be published there as well. ठीक है. So these are some of the government initiatives. But what are the challenges associated to this? First of all, we saw Kottapalya Act, smokeless tobacco products के लिए Kottapalya guidelines नहीं है. So if we say smoking is injurious to health or 75% of the packet may you should be showing that image wherein a person is suffering from cancer, all that is applicable to cigarettes. ठीक है? All that is applicable to any packet which is being sold, which is the filtered smoke. ठीक है? It is not applicable to smokeless tobacco products or unfiltered tobacco products. ठीक है? Unclear guidelines. For example, surrogate advertisements के लिए we do not have a regulator. For example, Pan Bahar, ठीक है? They are actually selling tobacco also. When they are making some kind of advertisement, they talk about elaichi, ठीक है? Some other flavoring agents that they market or advertise, but what they are actually selling is a tobacco product. So all such advertisements are called as surrogate advertisement, and we do not have a regulator for such kind of surrogate advertisements. ठीक है? Plus, ineffective National Tobacco Control Program. National Tobacco Control Program wanted to reduce, certain states have been designated as NTCP districts. Certain districts in particular states have been declared as NTCP districts, and we are trying to monitor and reduce the usage of tobacco consumption in these areas. ठीक है? But it is not being implemented effectively. ठीक है? Another problem is that of tax evasion. For example, one state has increased the cost to a great extent. The other state was not able to increase to such a great extent. So then majority of the market share will shift towards that particular state. So tax evasion, so that people pay less of taxes, they tend to buy cigarettes in some other state where it is relatively cheaper. ठीक है? Plus government interference in tobacco industry. Central government itself has approximately 7% stake in Indian Tobacco Company. Government itself is having stake, so obviously there is a huge nexus between politicians and industrialists in this case. ठीक है? Affordability of tobacco products. So tobacco products, although despite of such an increase, 14%, 13-14% was the increase in tobacco cost 2022-23 के budget में, but after that also it is still affordable. ठीक है? So these are the challenges. How do we deal with these challenges? First of all, if surrogate advertisement is a problem, we need to regulate the surrogate advertisement. So regulation of surrogate advertisement. Second is effective implementation of Prevention of Electronic Cigarettes Act. So electronic nicotine delivery systems such as e-cigarettes. So electronic nicotine delivery systems has to be controlled, ठीक है? But it is easily available in India, so we need to better implement the Prevention of Electronic Cigarettes Act, ठीक है? Then we also need to work on reducing the demand. We need to convince to the society, we need to convince to the farmer that we need to produce less and consume less of tobacco. Only in that case we will be able to deal with such a huge amount of tobacco burden. ठीक है? We will be able to effectively come out of this existing problem. Now with that we come to the end of this topic. I wish you all the very best. If you have any doubt, please do let us know in the comment section. Thank you so much.